discussion, hemostasis and thrombosis. This is the very key concept or very important step in wound healing. Okay? Ang pagtapal. Asya tiya pinaka general idea. Pagtapal hit sa mud. Hemostasis and thrombosis. So there are three phases of your hemostasis and thrombosis. First, the formation of platelet plug. Second, the formation of fibrin mesh. And pag okay na yung wound, the solution of it. So generally speaking, there are three types of thrombi. It depends on the area or on what blood vessel ang nasugatan. Kung meron kang nasugatang artery, very fast ang blood flow dyan, you will have a white thrombus composed of platelets and fibrin, of course, but less RBCs. Kasi fast flowing yung RBCs mo dyan, kasi artery. Now, if your vein is injured, magkakaroon ka ng red thrombus. Bakit red thrombus? Kasi madaming time ang RBC na dumikit sa fibrin mo. Kasi venous siya, mabagal yung flow ng blood. Then lastly, kung capillaries naman, yung na-injure or small blood vessels, fibrin deposits lang siya. Okay, walang RBCs na didikit, fibrin lang. Now, the first step of hemostasis or thrombosis is your platelet plug formation. Sinabi sa Harper's na tatlo lang ang steps. The adhesion, the release reaction or the release of content, and your platelet aggregation. Some books, 5 to sila. 5 steps to sila. Meron pa to yung dinagdag na, meron pa yun na adhesion pa. Adhesion, release reaction, aggregation, tapos meron pang repeat reaction ata yun. Basta lilimayan sila sa ibang books. Pero sa Harper's, 3 lang. Adhesion, release of contents, and platelet aggregation. Now, first step in the platelet plug formation. Adhesion. Ang tanong, how will it recognize an injured blood vessel? The presence of the collagen beneath the blood vessel, okay? Your platelet will be attracted to the collagen of the injured blood vessel. And your platelet has 3 major receptors that aids in adhesion. Your glycoprotein 1A, 2A, your glycoprotein 1B, 9 and 5, and your glycoprotein 6. Okay? Ewan ko kung bakit mga Roman numerals yung ginamit nila dyan. Pero those are the 3 glycoproteins na receptors for adhesion. Please take note the importance of your glycoprotein 1B, 9, 5. That receptor binds to the collagen with the help of von Willebrand factor. Without von Willebrand factor, hindi siya makakabind sa collagen, hindi stable yung platelet mo. Okay? So, pag may von Willebrand's disease ka, the adhesion is inhibited, okay? Because your von Willebrand factor, it helps the adhesion of your glycoprotein 1B, 9, 5 to the collagen. Okay? It is important in high shear stress blood vessels and stenosis. The platelet granules content is stimulated by the thrombin through the pars. Pars or your protease activated receptors are also receptors in your platelets that binds to your thrombin to mediate the second reaction, the release reaction. So, andito naman, andyan ata yan sa book ninyo. This is the general picture of your platelet plug formation, yung reactions dito. Okay? So your collagen will bind to your 1A, 2A and your glycoprotein 6 and your, well, hindi niya kinabit dito. Diyan. Dapat kumabit pa siya dito sa glycoprotein 1B, 9, and V. Pero makakakabit lang siya kung kung merong sa von Willebrand factor. Okay? Now, your thrombin, ang kanyang importance dyan is for your release reaction. Thrombin will bind to your glycoprotein 1B, 9, 5 to your protease activating receptor 1 and your protease activating receptor 2 or receptor 4 to activate your phospholipase C beta, your PLCB. Yan. Si PLCB ang daming gamit na reaction. Okay? It degrades your phosphoinositol biphosphate. Ito siya. Your phosphoinositol biphosphate from the plasma membrane of your platelet to your diacylglycerol and an inositol triphosphate. Yan. Diacylglycerol and inositol triphosphate. Your diacylglycerol will activate your phosphokinase C that would promote a certain reaction in the platelet, as well as your inositol triphosphate will increase your calcium that would promote another platelet response. So your diacylglycerol promotes of your plasticarin, then leads to the aggregation and release of granule contents. While your inositol triphosphate promotes the release of calcium. Now, when there is increased intracellular calcium in the platelets, it would promote the change in the shape of your platelet. It would become discoid na. Once it becomes discoid, madali na lang silang mag-aggregate. Okay? Unlike sa kanilang original form na spherical, na bilog sila, mahihirapan silang mag-bind to each other. Pero pag mataas ang calcium, mag-change ng shape yung platelet mo to a discoid one, magiging ganyan. So ang mangyayari, pag flat na yung platelet mo, madali lang mag-bind yung ibang platelet. Madali na lang silang mag-aggregate. And your calcium as well promotes your thromboxane A2, one of the product of your cyclooxygenase. Then your this thromboxane is a potent platelet aggregator and vasoconstrictor. Balik tayo sa diagram. So yan na yan. Diacylglycerol, phosphokinase, plasticarin, then inositol triphosphate. Now, we have the so-called inside-out transmembrane signaling. We have the so-called aggregating agents that modify the surface glycoprotein, yung sinasabi kanina na GP2B3A, to increase its affinity to fibrinogen and von Willebrand factor. Please take note, fibrinogen and von Willebrand factor promotes aggregation or binds one platelet to another platelet via glycoprotein 2B3A. So kanina, napag-usapan natin sa first slide, first discussion, yung tinatawag na Glanzmann thrombasthenia. Deficiency of your glycoprotein 2B3A. So pag wala ito, walang glycoprotein 2B3A, hindi makakapag-aggregate yung platelets mo, hindi sila makakapag-stack up, hindi magiging stable yung platelet plug mo and mag-bleed ka pa rin. And hindi makaka-initiate ng susunod na phase, yung coagulation phase. So aggregation is needed. Okay? That's the final part of your platelet plug formation, aggregation. Pag walang aggregation, walang gamit. Yung first and second step, mahina yung platelet plug mo. And it is promoted by your fibrinogen, von Willebrand factor, binding to your glycoprotein 2B3A. The activated platelets is accelerated factor 5, factor 9, factor 10, and prothrombin. We will be discussing this next step na, yung coagulation factors na natin. Very simple, ha? Very simple ang platelet plug formation. Adhesion to the exposed collagen. Summary na to ng platelet plug formation. Adhesion to the platelet plug formation. To the collagen in the blood vessel. Second step, release reaction, releasing all the chemicals inside the platelet para mag-conform yung kanyang shape. Pwede rin makarelease ng granules na. Then third is your platelet aggregation with the help of your glycoprotein 2B3A and your fibrinogen and von Willebrand factor. Adhesion, release reaction, aggregation. Three most important steps. Okay? Ang mahihirapan kayong ma-memorize dyan, yung release reaction talaga. Kasi maraming steps yung nangyayari doon. Meron tayong outside-in transmembrane signaling, yung sinasabi ko kanina, na yung thrombin magbabind to a specific receptor to your pars. Then, i-activate yung phosphokinase C beta that would degrade your phosphoinositol phosphate, bisphosphate to diacylglycerol and inositol trisphosphate, and both of them have their own reactions. Ito. Paulit-ulit yung diagram kasi kung pag-uusapan ng platelet, dapat parang hindi naman memorized, pero naiintindihan nyo to sila. Okay? Ito yung pinaka-importante. Yan. Kasi ito siya, your phospholipase C beta. Siya yung key enzyme inside the platelet. There will be no release reaction and no platelet conformation or change in shape without this phospholipase C beta. The major inhibitory enzyme naman inside the platelet, please take note of this, is your adenylate cyclase. Itong adenylate cyclase, yung kontrabida sa pagkakaroon ng platelet plug. Once activated, it will increase your cyclic AMP. And your cyclic AMP main action inhibits increase in calcium, intracellular calcium. So once inhibited ang intracellular calcium, increase in intracellular calcium sa platelet, maraming reaction ang hindi mangyayari. And may inhibit yung release reaction. Once inhibited yung release reaction, walang aggregation na mangyayari and mahina yung platelet plug na magagawa mo. Nakadikit nga yung platelet, hindi naman siya nag-change ng shape, hindi naman siya naka-release ng kanyang mga contents, hindi magpro-progress yung platelet reaction. So please take note, major inhibitory enzyme, adenylate cyclase. Okay? Which is promoted by your prostacyclin. Now, it takes two to tango. Na-discuss na natin yung platelet part. Pag-usapan natin yung the other half, the endothelial cells. Yung endothelial cells mo naman, siya yung partner mo na laging ayaw ng ayaw. Actually, siya yung nagpro-produce ng siya yung nagpo-produce ng mga factors na it would inhibit your platelets reaction. Like your prostacyclin, it is synthesized by the endothelial cells of the blood vessels, and it is also a potent inhibitor of platelet aggregation, as I was saying, adenylyl cyclase. Your adenylyl cyclase, as kanina na-discuss natin, increases your cyclic AMP or cyclic adenosine monophosphates that lead to inhibition of increase of intracellular calcium. That is the function of your prostacyclin. Ito siya. This one. Prostacyclin promotes adenylyl cyclase, increase CAMP, inhibits calcium increase. Then another inhibitory, ADPase, it hydrolyzes your ADP that eventually inhibits your platelet aggregation. Kasi your ADP, it is released to the dense granules, okay? And it promotes release reaction din, yung ADP, okay? So your ADPase is secreted by your endothelial cells that inhibits your platelet release reaction and aggregation. Heparan sulfate, natural anticoagulant. Plasminogen activators, yan yung mga tawag niyan, nagdi-dissolve ng fibrin clot mo. And your nitric oxide, it activates your guanylate cyclase. It decreases your calcium as well. Ito siya. So nitric oxide released from your endothelial cells would activate your guanylate cyclase. Your guanylate triphosphate would become cyclic guanine monophosphate that would lead to a decrease in calcium. That is the function of your nitric oxide. Please take note yung ina-act nila ha. Your prostacyclin increases your CAMP via adenylate cyclase. Your nitric oxide stimulates your guanylate cyclase, thus increasing your cyclic guanosine monophosphate. That would lead to decrease in calcium. Okay? Nitric oxide, CGMP, prostacyclin, CAM. Huwag niyong pag-interchange. So this is a table ang mga kanilang functions. Nasa book naman ninyo to, basahin nyo na lang. Pero the summary, na-discuss ko na sa inyo yun. We know now the platelet platelet formation. Let's talk about the medications that inhibit the platelet log formation. Number 1, acetyl salicylic acid, aspirin, pinakakilalang cyclooxygenase inhibitor. Okay? Ano yung ang pinopromote na eicosanoid ni cyclooxygenase is your prostaglandin and your thromboxane. Okay? Now, once cyclooxygenase is inhibited, mawawalan ka ng prostaglandins, mawawalan ka rin ng thromboxane. Thromboxane is a potent aggregator as we talked about. So, pag ang patient mag-take ng aspirin, di-decrease yung kanyang platelet aggregation because wala ng thromboxane. That is the effect of your aspirin. Yung aspirin, it also inhibits your prostacyclin synthesis. Pero, yung note that is that yung idea is that your endothelial cells can synthesize cyclooxygenase faster than bind to your platelets. Okay? So it is more of an inhibitory than a pro-aggregator. Okay? May dalawang function ng aspirin. It can inhibit thromboxane synthesis and prostacyclin synthesis. Pero it is more of a inhibitor of platelet aggregation rather than a promoter. Okay? Because of this idea that your endothelial cells can synthesize faster COX-1. Okay? Then your P2Y12 receptor inhibitors, clopidogrel, prasugrel, ticagrelor. It inhibit, ano tawag niyan? This one is a receptor for your ADP that promotes aggregation and release reaction. So pag i-inhibit mo tong receptor, i-block niya yung pag-bind ng ADP. So wala nang release reaction and aggregation. I guess some of your parents meron nagtitake nito, or some of you baka meron nang nagtitake nito. Any heart conditions or brain conditions na mga sugat, mga micro wounds na kailangan hindi ng platelet aggregation, nagtitake ng clopidogrel. Common to sa clinical aspect natin, as well as your aspirin. Lastly, antiplatelet lug is your GP2B3A ligand binding antagonist. It inhibits fibrinogen and von Willebrand factor binding to platelets, leading to impairment of platelet aggregation. Example is zizimab, eftimifabide, and tirofiban. This you will encounter in your pharmacy and internal medicine discussions on your second year. Hope you get the idea on this one. Because for you to be able to remember their functions, you have to master the steps and the components of your platelet plug formation. Okay? Acetylsalicylic acid inhibits cyclooxygenase. That leads to inhibition of production of thromboxane. That leads to inhibition of platelet aggregation. P2Y12 receptor inhibitors inhibits binding of your ADP to your P2Y12, thus inhibiting aggregation and release reaction. Mga ligand binding antagonists, it inhibits the binding of your fibrinogen and von Willebrand to of one platelet to another platelet, leading to inhibition of platelet aggregation. So, maiisipin nyo talaga dito, ang ini-inhibit nila, not the adhesion, barely the release reaction, but the aggregation. Kasi pag may aggregation ka, dyan nagkakaroon ng bara. Okay? Kaya mga stroke patients, mga myocardial infarction patients natin, meron to sila. Mga aspirin, pati mga clopidogrel. Kasi gusto nilang ma-inhibit yung aggregation ng platelet para hindi bumara. Okay? That is your antiplatelet drugs. Ito yung summary ng antiplatelet drugs mo. Kung ano yung kanilang inaanuhan. Meron pang mga PAR1, PAR2 inhibitors. Pero sa book, yung tatlo lang yung diniscuss. Ito yung mas mahirap. Pero we will himay-himay this. Kaya kailangan nyo itong maintindihan ng mabuti. Mapapagalitan ako ni Doc Mansanto pag hindi nyo ito maintindihan. The coagulation pathway is the second step of your hemostasis. Okay? It is the tawag niyan, most efficient on stopping blood coagulation. It is composed of proteins that have specific functions. Generally 5 specific functions. We will talk about that later. And it occurs either in an intrinsic or extrinsic pathway, but all happening inside the body. One is theoretical actually, the intrinsic pathway. This one is kumbaga na napag-aralan nila sa laboratory na, in vitro, that when you expose it to a negatively charged surface like the test tube, nagko-coagulate yung blood kung walang anticoagulant. Kaya meron tayong mga tinatawag na mga test tubes na red top sa mga medtech. Walang anticoagulant yun kasi the negative charge of the test tube glass promotes coagulation via intrinsic pathway. Inside the body, intrinsic pathway is activated by negatively charged molecules like nasirang protein, may lumabas na yung kanyang negative side ng kanyang amino acid, yung carboxylate side lumabas. So it will promote your intrinsic pathway. Your DNA, sabihin natin yung negatively charged na DNA lumabas, it will promote intrinsic pathway. However, ang pinaka-importante inside is your extrinsic pathway. Diba? Nakakalito. Importante siya pero importante inside pero extrinsic yung pangalan. When we say extrinsic pathway, the only activating factor is tissue injury. Please take note of that. Once na may tissue injury, it is the only time na ma-activate dapat yung coagulation pathway mo. Okay? Kasi as you go on, sa pag second year, meron kayong may encounter na DIC na pangalan. Yun yung abnormal coagulation pathway natin. Pero dito, normal tayo, intrinsic, in vitro, extrinsic, in vivo. Okay? In vivo means inside. Madaling ma-memorize ang extrinsic pathway. Kasi ang extrinsic pathway, dalawang factors lang. Factor 7 and factor 3. Your tissue factor and factor 7. And meron tayo, generally speaking, this one. This is the common pathway. Ito siya. Yan yung common pathway. Either extrinsic or intrinsic ang ma-activate, it would come to your common pathway that would lead to your fibrin mesh. Okay? It would promote meshing of your fibrin. That is the final product. So, as I was saying, there are 5 types of proteins involved in your coagulation cascade. The serine-dependent protease zymogens. When we say zymogens, inactive enzymes. Cofactors, the fibrinogen itself, it has a leg on its own, the fibrinogen. Kasi siya yung pinaka-goal, kumbaga. Number 4, transglutaminase zymogen. That's your factor 13. Okay? Kailangan, importante rin to siya kasi nakagawa ka nga ng fibrin, di naman stable, masisira lang yan. Mga short-term relationship. Yan. Walang transglutaminase zymogen. Then your regulatory and other proteins. So on your left, hindi ko to ipapamemorize sa inyo. Kasi anyways, kahit ako hindi ko to memorize. Tinanong ko lang dito yung mga masarap pakinggan. Apple domain, Kringle domain, kung sino meron dyan. Kasi hopefully, na-discuss na ba ni Doc? Hindi nyo maano kasi yung joke ko dito kung hindi pa na-discuss ni Dr. Monsanto yung mga domains ng protein. Na-discuss na ba niya yung mga protein? Wala pa? Wala pang protein? Tapos na. Anyways, ayan lang. Please take note, the apple and the Kringle domain. Okay? Those domains are very important because the specificity of the reaction is based on that domain. Ha? Then on your right, mga pangalan nila. Okay? Kasi merong mga prof na power tripping. Instead of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, tatawagin ka Hedgeman factor, Stewart Brower. Meron pa nga dyan Christmas factor. Yan. Pero anyways, don't worry about that na mga other names. All I want you to memorize is this one. Itong cascade na to. Kailangan meron kayong wallpaper nito sa inyong tawag niyan pader during med school. Kasi from time to time, mapa-surgery, medicine, or any kahit sa pediatrics, any major subjects ninyo on second year, third year, tatanungin kayo nito. Especially sa hematology part ng kanyang discussion. So fully memorize nyo itong coagulation cascade. Okay? So their functions, I will talk about their functions as we go along. Pero this is the summary of their functions. Now, on the microscope view na tayo. Extrinsic pathway. It is initiated, again, by tissue injury, leading to exposure of your tissue factor at the subendothelium and activated monocytes. Okay? Take note. When the tissue factor activates your factor 7, it is the key process in initiation of blood coagulation in vivo. Yan yung pinaka-importante na step. Kasi pag wala yung step na yan, walang coagulation na mangyayari. Walang fibrin na magproduce kung wala yung phase na yan. Okay? Your factor 7 is a carboxyglutamic acid containing coagulation factor as well as your factor 2, factor 9, and factor 10. Generally speaking, they are vitamin K dependent. So if you are vitamin K deficient, you have problems in your coagulation. Okay? And generally speaking, it has high affinity binding site to calcium. Then, the main aim of your extrinsic pathway is to produce your extrinsic kinase complex, calcium, tissue factor, and activated factor 7. This is, please take note, extrinsic kinase complex. This extrinsic kinase complex will activate your factor 10. By cleaving, please take note, arginine and isoleucine bond. Highly specific kasi biochem tayo. The arginine isoleucine bond. And it all happens sa phosphatidylserine surface ng platelets. Okay? Sa surface yan ng platelet nangyayari. Pag nakabind na yan sila sa platelet, yung extrinsic kinase complex, i-cleave niya in between your arginine isoleucine into an activated form, yung factor 10. Then your factor 10 will bind to your factor 5, then will activate your thrombin, then your fibrinogen. Okay? But to inhibit factor 10, we have the tissue factor pathway inhibitor or your TFPI. To inhibit factor 10A, ang gagawin niya, actually not directly inhibiting factor 10A, it will bind to your factor 10A muna, then it would bind to your extrinsic kinase complex. Once inhibited, hindi niya ma-activate na yung factor 10. Okay? That is the function of your tissue factor pathway inhibitor or your TF pathway inhibitor. Ano pa bang madadagdag ko dito? Anyways, ang gusto ko lang memorize ninyo dito, yung K process and those vitamin K dependent anti-factors 2, 7, 9, and 10. Okay? Tapos kung saan clinically, yung factor 10, arginine isoleucine bond. Diyan yan. Then, kung paano inhibit ni tissue factor pathway inhibitor, pag-inhibit niya sa extrinsic kinase complex. That is your extrinsic pathway. Very short lang. Konting recitatus lang talaga sa extrinsic pathway. Kaya siya yung pinaka-efficient pag-produce ng fibrin, the extrinsic pathway. Unlike your intrinsic pathway, kasi ang nagdidikta dito, mga scientists, i-complicate nila. Ang daming factors. So, let's start. When your prekallikrein, high molecular weight kininogen, factor 11 and factor 12. Imagine, 4 na factors pa ang kailangan para ma-activate siya to a negatively charged surface, such as your extracellular DNA, RNA, or polyphosphate. Those are the triggers. Now, how does it start? Molecular weight kininogen and prekallikrein will activate your factor 12. Okay? Now, when your factor 12 is activated, it will promote a positive feedback mechanism, positive activation loop. So, activated na siya, it promote activation nito na high molecular weight kininogen and your prekallikrein. Now, pag activated to sila, activate na naman to, paikot-ikot lang yan sila. Yan. Ang kanya activation. Pero dalawa function ni 12A, hindi siya consolidated lang dyan. Once your factor 12A is activated, it will activate your factor 11. Okay. Uniquely, once na ma-activate na yung factor 11, it would promote bradykinin release. Okay? Bradykinin release from your high molecular weight kininogen, HMWK, high molecular weight kininogen. Then your activated factor 9, or factor 11, will activate your factor 9. Nag-jump sila ng factor, ha? Ang factor 10 is your target kasi. So, 12, 11, along with calcium, will activate factor 9. Okay? Factor 9, along with your factor 8, will activate your factor 10. That is your intrinsic kinase complex. Yung extrinsic kinase complex kanina, factor 7, factor 3, calcium. Bump each other. Yung intrinsic kinase complex, factor 8, factor 9, calcium. Okay? Both kinase will activate your factor 10. Yan sila. Uniquely for factor 8, it is a cofactor that is activated by minute amount of thrombin. It acts as a receptor on platelet surfaces, as na napag-usapan natin kanina. And factors activated factor 9 and 10. Then it is inhibited by protein C. So this one, your intrinsic, initiated by activation of your factor 12 by your high molecular weight kininogen and prekallikrein, leading to activation of factor 10 via factor 9, factor 8, and calcium, also known as your intrinsic kinase complex. Now, meron na tayong activated factor 10. Your activated factor 10 will bind to your factor 5. Kailangan kasi. As well as to your prothrombin. Okay? Ito sila. Factor 10 will bind to your prothrombin. Factor 5 na na-activate niya, no? 10A will bind to your prothrombin. in your platelet surface. Ito siya. Ito siya, phosphatidylserine surface to ng platelets. Ha? Your factor 5 is a cofactor found in the plasma and platelets and is activated by traces of thrombin and binds to platelets. Ito siya. Ganyan. So, kailangan mangyari in the surface of protein of the platelets, and it should be bound to your prothrombin so that your prothrombin should be activated. Okay? Now, your prothrombin would be activated by your mainly factor 10. Please take note of that. Prothrombin would be mainly activated by your factor 10 only in the presence of factor 5 as a cofactor. Okay? So, prothrombin is synthesized in the liver, binds to factor 5A and factor 10A to be activated via cleaving by your factor 10. It is regulated, this mechanism is regulated by your feedback mechanism and antithrombin. Okay? When we say feedback mechanism, when the body senses that madami ng thrombin, it will decrease the synthesis of prekallikrein, high molecular weight kininogen, and other factors para konti lang ma-activate na thrombin. That is your feedback mechanism. Now, when we say antithrombin is a direct enzyme inhibitor of your thrombin. Direct reaction siya. So those are regulatory function, nagre-regulate sa prothrombin. Ang gusto ko lang maintindihan ninyo na kailangan ang factor 10, factor 5, and prothrombin andyan sa platelet surface na yan. Kasi dyan magsa-stabilize ang reaction. Okay? And ang main action ng cleavage ng factor 10 ng prothrombin is due to factor 10A. That is the main cleaving enzyme factor dyan. 5 is just a cofactor. That is your common pathway. And the final product of your common pathway is tawag yan? Activation of your fibrinogen. Your thrombin, aside from activating your fibrinogen, can also bind to your thrombomodulin. Okay? Once thrombin is bound to thrombomodulin, it will promote activation of your protein C. Protein C is one of the major inhibitory factors or proteins in the coagulation system. Kung nakita nyo sa slides, marami siyang mga ini-inhibit like this one. Factor 5 is inhibited by protein C. Factor 8A is inhibited by factor C. So maraming function ang protein C sa pag-inhibit ng coagulation pathway. And ayan, ito nga, hindi ko nabasa. Degrades factor 5A and factor 8A. Andyan na yan. Now, let's go to your fibrinogen. Fibrinogen is mainly produced by your liver. It is a circulating protein that wherein there is tissue injury, it will be activated by your factor 2 or your thrombin so that it would become a mesh along with other fibrin. So this is the primary structure of your fibrinogen. Okay? It's a dimer. Okay, this is a one part and the other part composed of 3 strands A, B, and alpha, beta, and gamma. Okay. Composed of dimer, 3 polypeptide chains, alpha, beta, and gamma, and linked together by multiple disulfide bonds. Ito siya. Itong brown na to, yan yung mga disulfide bonds mo. Yan yung mga disulfide bonds mo. Given that this is the structure, it produces 3 domains. Okay? 2 D domains, 1 A domain. The A domain, this one. Ito siya. Yung space dyan na nagawa after binding of the three polypeptides dito on each side. And baka may ano sa inyo magtanong, Doc, unsay coiled coil? Coil na siya, kinoil pa. Actually, this is a coiled amino acids or coiled polypeptides na coiled. Na-imagine ninyo, coiled na siya, tapos pinulupot pa. That's why it's called coiled coil. Pero anyways, ang pinaka-importante natin dyan, the 3 domains. Okay? Yan yung ating pag-usapan. Those 3 domains are the most important part of your fibrinogen because their function is to attach to other fibrins and to be stabilized. Now, the amino terminal of your A alpha and B beta are termed fibrinopeptide A or FPA, this one, fibrinopeptide A, and fibrinopeptide B. Yan sila. To activate fibrinogen, kailangan mo yan siyang i-cleave. Okay? This is your thrombin. This one. So to activate your fibrinogen, FPA and FPB, i-cleave niya para open siya dyan. Once na ma-open yan dyan, it will bind to other fibrinogen na kasi open space na siya. Okay? So, yung fibrin monomer were in the exposed binding sites in the A domain. This is the A domain naman. Interacts the complementary sites of the D domain dito. So, parang yan na yan yung mangyayari. So your thrombin will cleave your FPB and your FPA via the arginine glycine bond. Cleave na yan. Once na-cleave na yan, yung specific region dito ng ibang fibrin will bind to the exposed areas ng E-domain ng ibang fibrinogen. And imagine magsa-stack up yan sila. Ganyan. Diyan. That is the function. That is the sequence of your fibrin clot formation. Okay? Thrombin will degrade the FPA and FPB, exposing these sites. Then specific areas of the D domain will bind to the E domain. You will ask, Doc, human na. Total, may fibrin clot ka naman. Okay na yan. Tapos na. Every relationship, ika nga nila, kailangan may stability. So, dito sa relationship na to, between two fibrin clots, or fibrin proteins, para maging stable sila, kailangan mo ng factor 13. That is a transglutaminase. Okay? Doc, unsa may buhaton ni factor 13 para maging stable ang duha nga fibrin. It would bind yung lysyl portion ng fibrin to the glutamyl portion of another fibrin and bind them, resulting in an ammonium byproduct. This process is called cross-linking. Okay? It cross-links your gamma chains and your alpha chains of the two fibrin. Ito siya. To stabilize the fibrin clot. Okay? But please take note, Dahil biochem tayo, yung amino acid, lysine and glutamine. That is the amino acids being acted by your factor 13. Si thrombin, please take note, arginine and glycine bond. Pag-remove niya ng fibrinopeptide A and fibrinopeptide B. Okay lang tayo? Okay lang kita? Nakuha man, no? Or kailangan ko utrohon or more specific? Silence means yes. General rule. Anyways, all I want to impart with you dito sa coagulation cascade is that spontaneous to sila and highly specific and highly moderated. Each step, you have to understand what is being reacted, and each step, kailangan yung malaman and definitely ma-memorize kung anong area yung ina-act nila. Ha? This is only part of your biochemistry. Pero sa ibang subjects, ma-rigorous talaga to sila. Ang dito lang sa biochemistry, specificity ng mga reactions natin. What amino acid? Yan yung mga tanong. What amino acid or what amino acid bond? Yan yung tatanungin sa inyo. Na-quiz na ba kayo sa biochem? Wala pa? Never pa? My God. Sige. Good luck. Now, regulation. We're done. Tapos na. Meron na tayong fibrin clot. Stabilize na yung kanilang relationship with factor 13. In every relationship, kailangan rin, pag okay na, nakuha nyo na yung mga kailangan nyo sa isa't isa, kailangan sirain. Yan ang gamit ni plasmin. Okay? Si plasmin, hindi siya epal. Siya lang yung conscience mo na, tapos na, hindi nyo na kailangan ng isa't isa. So plasmin is a serine protease that degrades fibrin and fibrinogen. Okay? It is inhibited by alpha-2 antiplasmin. And to activate, this is an activated enzyme na ha, yung plasmin mo. Yung kanyang zymogen is plasminogen. So, biochem kasi tayo, specific, arginine-valine bond. Daminan yung relationship na dapat ma-memorize ng mga amino acid. So, to activate plasminogen, kailangan mag-cleave yung arginine-valine bond within the polypeptide of the plasminogen to be activated. Very specific, dalawa lang. TPA and urokinase. Okay? Tissue plasminogen activator and urokinase. Given the name, tissue plasminogen activator, along with tissue factor, release during injury. Okay? And urokinase is an enzyme na pinoproduce rin. Specificity is based on binding of one of its Kringle domain to the lysine residues of the fibrin. Again, na-mention to kanina, specificity is based on the Kringle domain. Kringle is a Scandinavian pastry na kanina parang heart shape lang yan sila ng mga pastry. Search nyo lang sa internet yung shape niya. Pero please take note, the specificity is based on the Kringle domain. Okay? We are fibrin. Then, we have also the thrombin activatable fibrinolysis inhibitor. It is a carboxypeptidase that removes terminal lysine residues in fibrin. So, pag walang lysine residue sa fibrin, walang Kringle domain ang na naka-expose, walang iaak ang plasmin. Okay? Yan yung kanyang pag-inhibit sa plasmin or pag-kontra sa plasmin. Tatanggalin niya yung lysine na may Kringle domain. Kaya hindi madi-dissolve yung fibrin clot mo. ng plasmin. Please take note of that. Management, medical, fibrinolytic therapy. So, given na dalawa lang sila na nag-activate ng plasminogen to form plasmin, dalawa rin lang silang ginagamit sa medicine. Your TPA, alteplase sa market, then urokinase. Streptokinase. Streptokinase parang urokinase lang yan pero produced by your streptococcus. TPA is more preferred than streptokinase because yung streptokinase hindi mo makontrol yung kanyang effect kasi non-specific siya. Okay? Yung kanyang parang hindi niya ma-detect kung plasminogen ba to o hindi. So, ang ginagamit, TPA lang. Please take, ito sila, elaborate pa to sa pharmacology ninyo. Pero gusto ko lang maintindihan ninyo na mas preferred ang tissue plasminogen activator kasi mas nakokontrol ninyo ang effect niya. Unlike your streptokinase, non-specific siya. Now, ito. Kung hindi nyo man ma-dissolve ang fibrin clot, meron namang antithrombin para hindi mag-form ng fibrin clot. It contributes to 75% of your inhibiting thrombin. That is your antithrombin. Madali lang yan ma-memorize. Antithrombin inhibits thrombin. Unlike your plasmin, degrades your fibrin clot. Antithrombin is not so specific. It can also inhibit your factor 9, 10, 11, and 12. That is, kaya minsan tinatawag yan na ang intrinsic pathway mo, thrombin pathway, kasi na-inhibit siya ng antithrombin mo. Meron rin yan test sa laboratory na kung ano yung deficient sa patient na factor. Lalagyan mo ng antithrombin. Kung mag-clot or hindi, depende yan sa kulang mo na factor. Now, there are also proteins na nag-inhibit sa thrombin. Your alpha-2 macroglobulin. What's unique with your alpha-2 macroglobulin? Sa ating previous discussion, siya yung may bait process. Okay? Or your bait sequence. Yung parang fly trap, yung kanyang image was fly trap, yung alpha-2 macroglobulin. So, also your heparin cofactor 2 and your alpha-1 antitrypsin can also inhibit your thrombin. Now, what's the function of your heparin? May antithrombin ka na. Ano pang kailangan ng ano pang gamit ng heparin? Parang si heparin, parang lang siya, pinapalakas lang niya yung effect ng antithrombin para mag-bind to thrombin. So your heparins, or also known as your sulfated glycosaminoglycans, binds to your antithrombin, thus promoting binding of the antithrombin to the thrombin and factor 10A. Okay? Sa ibang college, sa pre-med, some books doon sinasabi na ang heparin nagbabind sa thrombin. You should know better kasi doctors kayo. Ang heparin nagbabind sa antithrombin. Okay? Ang kanyang function is to promote the antithrombin to bind to thrombin. Okay? Not directly inhibiting the thrombin, but promotion of binding of your antithrombin to thrombin. Para makatrabaho yung antithrombin mo, ma-inhibit yung thrombin. Pero heparin itself does not inhibit your thrombin. Okay? On the clinical basis, meron tayong mga heparins and your low molecular weight heparins. Pero at this point in time, ang mga clinicians mas ginagamit na yung low molecular weight heparins. Kasi mas yung kanilang reaction mas mas controlled. Kasi pag purely heparin ang gamitin mo, not low molecular weight heparin, hindi mo alam kung anong mangyayari sa patient. Kasi most of the studies, pag magbigay ka ng purely heparin talaga, not low molecular weight, ang daming adverse effects, ang daming bleeding disorders ang lumalabas. Unlike your low molecular weight heparin, the effect is equal to the dosage. So most physicians would choose low molecular weight heparin in their practices. And antidote for your heparin toxicity is your protamine. Heparin is inhibited by protamine. So another anticoagulant, your coumarin drugs. Okay? Mainly in the warfarin sa practice. It inhibits very specific vitamin K dependent carboxylation of glutamic acid and carboxyglutamic acid. Okay? Ano yung ating mga vitamin K dependent drugs? 2, 7, 9, 10. Tapos ibang protein C and protein S. Those are your vitamin K dependent. So pag kulang ka ng vitamin K, bababa yung yung factor 2, 7, 9, 10 protein C and protein S. Now, gusto mo naman walang coagulation, tapos gusto mo gumamit ng warfarin. Ang gagawin niya, yung vitamin K mismo, o yung reactionary iniact ng vitamin K, yung carboxylation, very specific ng glutamic acid and carboxyglutamic acid, ini-inhibit niya. Okay? It's not the vitamin K itself na kanyang ini-inhibit, but the reaction. Okay? The reaction ng carboxylation to synthesize factor 2, factor 7, factor 9, and factor 10. Okay? So coumarin also inhibits the reduction of quinone derivatives of vitamin K to the active hydroquinone forms. And vitamin K administration will bypass the coumarin inhibition within 12 to 24 hours. So pag sobra ka ng coumarin, magbigay ka lang ng vitamin K. Okay? Kung vitamin K, usually ginagamit namin to sa clinics katatapos pa lang ng IJ catheter insertion. Usually gumagamit kasi ng ng anticoagulant when you do IJ catheter insertion. Tapos tatawag yung nurse, "Dok, sigit dugo, dili na undang." Tapos ang mangyayari, magbibigay lang sila ng vitamin K. Tapos pressure 1 hour. Okay? Usually that's the function of your vitamin K. Inhibit the bleeding or stop the bleeding. Now, so in antithrombotic therapy regimens, please take note, heparin is given first due to its immediate effect. First choice, heparin. Next mo na is warfarin. Kasi kailangan your warfarin will take effect about a week pa, 5 to 7 days pa. Yan yung So heparin muna, low molecular weight heparins, then your coumarin na. Then there are new oral inhibitors of thrombin and factor 10. They are more advantageous na because predictable dose-based results. Unlike your coumarin and your warfarin and heparin, meron pa talagang times na hindi mo hindi nako-control yung kanilang effect. These are only some of your bleeding disorders. Marami pa sila. Okay? Pero Ito yung mga pinaka-common na tinatanong. Hemophilia A, please take note, deficiency of factor 8. Hemophilia B, deficiency of factor 9. Then as I was saying kanina, von Willebrand's disease, it is the most common hereditary bleeding disorder. Why? It inhibits binding to the collagen of your platelet. It inhibits platelet aggregation. So, yan yung nangyayari sa von Willebrand's disease mo. Yan. Tapos